We're very excited to be here. Want to introduce who we have today. We've got a great lineup. We have Ben Utecht. He was an NFL tight end for 6 seasons, and he played for the Indianapolis Colts and also Cincinnati Bengals. Ben won his amazing Super Bowl ring with the Indianapolis Colts in 2006. He also has incurred 5 diagnosed concussions during college and his NFL career. He played at the University of Minnesota. He retired from pro football in 2009, and he is now an actor, musician, and inspirational recording artist, and he also is the spokesperson for the American Brain Foundation and the American Academy of Neurology. So welcome, Ben.
Thank you.
And then we have Dr. Jeff Kutcher from the University of Michigan. He's a board-certified neurologist, and he specializes in sports neurology. He is the director of the University of Michigan's Neurosport program, and also he works with the University of Michigan's athletic medical staff. He's a consultant for the NHLPA and the NFLPA. And also he is the neurologist for the U.S. ski and snowboard team and the neurologist with the U.S. Olympic team at the Sochi Olympics and the co-chair of the American Academy of Neurology's Sports Concussion Conference. Welcome, Doctor.
Thank you.
And I'm Joanne Gerstner. I am a sports journalism professor at the University of Michigan State University. Too many University of Michigan's in my brain. Michigan State University, and I also was a Knight Wallace Fellow at the University of Michigan where I studied concussions in sports. I've been a sports writer for 20 years with the New York Times, ESPN, USA Today, and the Detroit News. And Dr. Kutcher and I are working on a book about youth sports and concussions that hopefully will be out later this year. So welcome to our panel, and hopefully you will get to know a little bit more about what sports and neurology have in common. There's me. So we'll get going. The way we organize this is into quarters, and what we're hoping to bring you is the perspective of both the neurologist and the athlete, because sometimes they're aligned and sometimes they're not. So we'll start with you, Ben. When you were playing, what did you know about concussions? Did you at all think about them? And how did you just go through your daily life as a player?
Well, that's a great question. Really, the issue of concussion was never evident. It was never something that was a part of an understanding in football growing up. I mean, I started playing tackle football in 4th grade, and I actually, including all of my concussions in the NFL, never once saw a neurologist. It's somewhat alarming, and really just within the last 2 to 3, 4 years has this issue really become something now that is becoming understood by athletes across the board. It became real for me. It became real for me because it started to affect my cognitive skills, my cognitive abilities, primarily my memories. And I said this when speaking to the Senate Committee on Aging, that I didn't begin to care about my mind until I began to lose my mind. And it really started in 2007 when I took a concussion against the Denver Broncos in the first quarter. You wouldn't even believe it. It looked like a gentle kick as a defender was jumping over me. His cleat just grazed the back of my helmet, and you saw my head bob down a little bit. And the next thing you know, I'm completely unconscious on the field. I was unconscious for about 20 seconds. Teammates surrounded me. I finally came to. I started to get up. I'm having a conversation with them, and I sprint off to the sidelines. And I'm having conversations with my coaches, with my athletic trainers, and the doctors on the side of on the sidelines. And I remember nothing until the end of halftime. I don't remember any of it. The only way I can speak about it is because of watching it on film. And it was the first experience that I ever had with amnesia due to a concussion. And for the first time in my entire career, since playing football in 4th grade, did it become real to me. Because 2 hours of my life were completely gone. I don't really know how to explain what that actually feels like. How was my body functioning? How did I get up and have conversations with people? How did I sprint off? And I don't remember any of that. So that's really when concussions became real to me, is when they actually started to affect my cognitive abilities, my memories.
So Dr. Kutcher, what's on the other side? How do doctors on the sideline know a concussion has happened, and how does that whole process work?
Well, first, let me just take a moment and say thanks for having me, South by Southwest, and thanks, Joanne, for organizing this. Concussions, somebody asked me recently, how long does it take to diagnose a concussion on the sidelines? There are all sorts of examples of athletes who, on video, on TV, or even on your own local high school level or youth soccer, you see a kid and you're like, oh, well, obviously that's concussion. Well, how long does it take to make a concussion diagnosis? The answer is anywhere from 5 seconds to 2 days, depending on the injury. Concussions don't always show up right away, right? The symptoms, the signs, the findings sometimes take hours to develop, sometimes not till the next day. And so the process of diagnosing concussion is not something we can do all the time. At one point in time, get it done, yes or no, you're concussed. So what we do as physicians is we take a step back and say, I don't really need to diagnose that concussion, yes or no, at this moment. What I really need to do is protect the safety of that athlete, the health of that athlete. And so I treat them as if they're concussed until I can prove otherwise. That's sort of the step we take. And so diagnosing concussion in the sideline environment, which is where we're starting here in the first quarter, is kind of a fallacy. Yeah, there are the obvious cases, the unconscious athletes, the big hits where there's clear loss of consciousness. Those are the vast minority of concussions, though. Most of them don't have that obvious hit. And so we have to be vigilant. We have to have a comprehensive approach to evaluating a patient. There's not a simple test. There's not a simple tool. It's basically being a neurologist and getting to know what an injured brain looks like. The trick of it is that for some people, their injured brain looks a lot like the normal brain of somebody else, especially if you're talking about somebody in an athletic environment. So it can be very, very tricky. Joanne put a couple of slides up here, or one slide up I just wanted to point out. On the left is a picture I took with my cell phone at last year's Michigan-Ohio State game. That's the view I have, right? That's the best it can get on a college football sideline, the view, which is terrible. I mean, if somebody gets hit in the backfield, on the other side of the field, I have no chance of seeing that whatsoever. So the medical staff's at a disadvantage, a natural disadvantage on the sidelines because it's the worst seat in the house. But it's where we have to be, so I have access to the athletes so that I can observe them when they come off the field, how they're talking to their teammates, how they're talking to the coaches. That's incredibly important, but my view is god-awful. And so you'll see a lot of, and this is, of course, we're talking to NFL level, but think about this for every level of sport. We have these press box. We get the picture of the press box here from Minnesota for Ben. Just to give you a sense that, yeah, you can see the field better, but man, you were so far away. Like how can, even with binoculars, now you got to try to follow the play, and so that's not even a real good solution either. And now we're bringing in video to help us on the sidelines and in the press box to be able to watch the play. The bottom line is it's an incredibly complex, difficult thing to do, and one that requires really the input of anybody who's there, right? Anybody who has any sense of authority or responsibility, the referee, the coach, athletic trainers, the doctors, everybody has to pitch in and help look at these situations so that when somebody is potentially concussed, we identify that as quickly as possible and bring them off. One other thing, I think, Ben, I'll ask you this quick question. When you had that sprinting off, talking to your teammates moment, you don't remember this, but what do you think would have happened if somebody had asked you, how you doing? What would you have said?
I have no idea.
Okay. Well, okay, so having been there many times asking athletes, you probably would have said, I'm good, let's go. I'm good to go. Good to go, Doc.
I mean, I've had moments where my teammates have been concussed, and you're asking them questions, and they are making completely no sense whatsoever. It's kind of like them saying, I'm Batman. I mean, there's nothing that's working right in their mind. I mean, it's so clear that, and I have to imagine that that's what was happening because they immediately removed me from the game, and the next thing I know, I'm in the locker room.
One of the things you hear all the time, whether it's NFL, Olympic athletes, youth soccer, high school, whatever, is athletes are trying to hide their symptoms, to be tough and stay in the game, right? And so they'll hide things. They won't be completely truthful about how they're feeling, and that does happen a lot. But one of the bigger lessons I've learned is that it's really common that they're just concussed. They just don't know it, right? And what that means to me is we have to take over for them and protect them from themselves because they're impaired. Just like you wouldn't let somebody, go in a football game drunk, You shouldn't let them go back in concussed, right? So you have to take over for their sense of faculties.
So Ben, let's talk about, you're with the Bengals, it's 2008, you get hurt during a practice, and just about recovery to go through and how the decisions you had to make and how that factored into the rest of your life.
Yeah, let me build off of what Dr. Kutcher was saying, because it is true. I had 5 diagnosed or documented concussions because all of them were complete and total knockouts. I mean, it was clearly that I had a concussion. How many did I hide? Quite a few. For exactly what Dr. Kutcher was saying. In 2008, I remember one clearly. I took a head-on collision with a linebacker in just a routine blocking drill, and I remember my vision completely going black, and finally came to, and everybody, the training staff, were all asking me the concussion questions, and I did exactly that. I hid them. I lied. I told them that I was okay, and I went home that night, and I woke up at about 2 o'clock in the morning, and I had completely sweat out my bed. I had a horrible headache. I was dizzy. I woke up my wife. I really didn't know what was going on or what to do. I did know at that point that I had a concussion. But here's the thing. I had just signed this big contract with Cincinnati. I was supposed to be their breakout tight end. I had already missed half the season because of other injuries, and I wasn't about to let down my team one more time. So I went back in that week, and I went to practice, and I went in and I played, even though I never should have done that. But I was so concerned about letting my coaches down, letting my teammates down, letting the staff of the Bengals, who put so much time and money into me coming there, and really, and Joanne, maybe you can respect this, really the media and the pressure that I felt from the media to have to perform. I was already getting ridiculed for coming to Cincinnati and not producing because I've been injured all year, and I knew that, and that affected me, and I wasn't about to let that happen again. So tremendous pressure from many different areas really is what keeps a lot of athletes from confessing to what they're actually going through.
So Dr. Kutcher, how do you deal with that from your end? Because obviously Ben has to do what he felt was right from at this point, but obviously on a diagnostic side, from what you're trying to do and trying to help the athlete, how do you just kind of work through that whole situation where you need to do what you need to do to figure this out, but he might be keeping stuff back?
Well, I mean, to be frank, evaluating evaluating the brain of a living person is a difficult thing to do from a physician standpoint, and it's something that neurologists are trained to do sort of better than any, or more so, I should say better, excuse me, I don't want to offend anybody, but more so than any other specialty, and which is why I think, I'm very excited to start working with Ben more and get neurologists more in this conversation, because we are trained from day one to recognize impairment in people who are denying it, or lack of impairment in people who are saying they have it. Every case we see in clinic, in the ER, in the hospital, you name it, the first thing that we deal with is this real or not? Or is there something that hidden beneath what this person is presenting with? Right? That's what we do. So you apply that to the sports environment, and it's never more helpful than on the sidelines, right? And in the training rooms, where it is a very natural thing for athletes to kind of become insular when they're injured and not express their vulnerability. So I think part of the answer is we need to just have the right people in place to be able to do examinations and do histories and understand human behavior. Makes it more complicated, though, is it's incredibly more helpful for a physician if we know that athlete beforehand, right? So therefore, the team physician, the team athletic trainers who have seen the athlete, go through games and go through practices and see them on Sunday and see them on the plane afterwards, we know how they behave typically. That becomes very, very helpful. But the flip side of that is being a team physician means you work for the player, you work for the patient, you don't work for the team, right? And so you have to be very, very clear I don't care what level you work at as a physician or an athletic trainer, that you work for that player and not for the team. That being said, it still can be very, very difficult, especially in the professional world, for athletes to trust their physicians and their athletic trainers. And to be frank, I don't blame them, because there is an incredible ethical dilemma there.
Well, because a lot of the staff of those doctors are actually paying money to the team so that they can, have the right to say that they are the team physicians for the Bengals. So if you're the player, you really lose that sense of confidentiality, that non-biased opinion, and it is challenging. That's why we are always going to get second opinions.
Right, and that's an important part of the process, for sure. So, I think if you're ever in that role of being physician, athletic trainer, or parent on the sideline of a soccer game or whatever, I mean, you just have to take yourself out of that competitive environment and say, this isn't a game, this isn't a playoff game, this isn't the state championship, it isn't the Super Bowl. This is somebody's brain that I got to deal with. That's first and foremost. I'll give you guys a little sort of homework assignment for this coming fall when you watch college football. Watch college football. In the pros, it's different. But if you look by the kicker's net on the sideline, right, where they practice, where they kick into the net, that's usually where the physicians huddle or stand. I don't. I go all over the place because I want to observe my potential patients' behaviors in different situations, but typically physicians are standing there by the net. If you see a moment of the team scores a touchdown or there's some exciting thing happening, look for those physicians, see what they're doing. And you'll see an incredible variance of behavior. For me, one moment of showing that I care about the team, I lose my job, my perspective, right? I care that they do well. I care for my players. I want them to succeed. I want them to be, happy and successful. But I don't care about the team one iota. You can't do that. And just so when you observe that, you'll get a sense as to maybe some how things are approached in different institutions. Put it that way.
So let's move to the second quarter of this. So Ben, you're trying to hide your concussion from the media, from the fans, from your team, because you want to continue your career and obviously maintain the respect of everybody. But you weren't okay, and you had some really tough times after that and some big decisions to make. So how did you come to the conclusion to retire? Just kind of walk us through where you got.
Yeah, that was definitely a tough process. In 2009, I took my fifth and final concussion in training camp. It was nationally televised on HBO Hard Knocks, which was an interesting experience to be in. For another discussion for another time, but it was a scary moment because I was unconscious for about a minute and a half, and had to be strapped down to a stretcher, taken to the hospital, and then that really began an 8-month rehabilitation process for me to get back to a place of what they call new normal, a new normalcy, but the interesting thing is I did all that rehab and I finally got cleared, and you would think at that point, with my past and my history of concussions, that I would be done. But yet I had my agent on the phone calling teams. I worked out with the New England Patriots. I mean, I was ready to go back. And it wasn't until I went back home to Minneapolis and was visiting some friends, and we were sitting at the dinner table, and I said to my friend Matt, we started talking about wedding memories, and I said to my friend Matt, why wasn't I able to be at your wedding? And he kind of looked at me funny and just took it as sarcasm and brushed it off. And I said, no, seriously, Matt, why wasn't I able to be at your wedding? And the whole table got silent. My wife, Matt and his wife, and Kim, his wife, got up and went and grabbed their wedding portfolio, and they brought it over, and page after page, there I was. On every page, I was a groomsman in his wedding. I sang in his wedding, and I have no memory of that day. I've tried. I go back, and I try and remember what it was like to stand next to one of my best friends, and it is completely gone. And it was that moment, for my wife, when we finally stepped back and said, wow, is losing my mind really worth playing a game that I love to play. And that really began the process of having to make some really difficult decisions. And that's when we chose to walk away. And that's where, that's where my passion for speaking on this has come from, is because it really took me caring about this issue, you guys. It really took me to have an experience with it, so that all of the education that I get from the experts actually matters. It's one thing to hear training and education, but it's another thing to care about it so that it actually has an effect. And it was that moment where it actually made the effect, and I had to make a tough decision.
It must have been very powerful, though, with your friends to realize this, when your friend's wedding, you usually remember that, hopefully.
Well,
so.
and that's been, and I know Dr. Kutcher we've talked a lot about this. I mean, you have a lot of guys who experience behavioral problems. You have others that experience memory problems, and there are other issues in there, but those seem to be the two that are always at the front of what we hear in the media. And for me, it's been the memories. And there's a couple handfuls of stories now in my life at 33 years old, like that one. And there, it's hard to explain what it feels like to be sitting at a table with your family over the holidays and hear stories, them talk about stories, and you kind of just sit there going, okay, I cannot place myself there. And so, that's why this is an important issue for me.
So this comes up in your practice. How do you approach that with your athletes and go through the keep playing or retire issue?
Well, so this is part of our talk, the second quarter. We're move from concussion into a more general discussion, and you notice that the title of our talk is not anything about concussion, because I think that term gets overused and used inappropriately a lot. Concussions, the episodes of brain trauma that cause a transient, temporary, set of symptoms is one thing. But it's the overall long-term additive effect of multiple hits, whether you are concussed or not, that can start a second process ongoing, right? And so in this phase, a patient, like Ben, who would come to me and have these issues, you have to go back and dissect really their whole life, right? Because if I went to a average neurology clinic and just sat in the waiting room and asked people why they were there, there'd be a heck of a lot of people in their 30s and 40s who are worried about their memory. And when you start digging into their histories, they don't sleep well, they have depression, they have other issues. You fix them and their memory gets better. So you have to really dig into this stuff. And this is one of the first times I'll mention one of the biggest points of this talk I want to make, is just because somebody played football, just because they were exposed to trauma in the military or hockey or wrestling or soccer or whatever, don't stop thinking about what could be causing their problems. I see that over and over again, that people at this point, the media has gone, I'm sorry, Joanne, but so viral with this episode, this issue, that people just really make assumptions that, of course, it's because you played football, of course it's because you played soccer, and you know what? I'm sorry. Sports giveth, sports taketh away. But that's not true, right? That is not true almost every time. People do get better. And so what you have to do in these situations is help the patient make the best decision that's best for them and their family, right? Care for them as a physician, help them improve from their headaches and their sleep and their memory best you can, and then arm them with information. Some players, some athletes continue to play. They understand the risk. They understand that they only have 3 or 4 more years to provide for their family in the financial way that they've been, building up for their whole life, and so they take those risks. But you want to be able to give them the best possible information. For me, there are 3 reasons that I would look for as far as framing the I should retire conversation. One is there a sense that there's a change in the threshold of what it takes to injure you, right? Does it take less of a hit? And I think your last concussion was very much not a big hit to cause an injury. Now, in Ben's case, that was a very obvious scenario. It is, however, also common that people assume that they're getting injured more easily when, in essence, they've just been labeled as a concussed person. And so every time they get a headache after playing sports, they're labeled as having another concussion. And so you can go down this path of, once you're diagnosed with concussion, it's easier to diagnose you with concussion because again, people stop thinking about why you're having these symptoms. But in a case like Ben's, when there's a clear injury, a clear physiological state that's induced by a minor blow to the body or the head, that's reason one, right? Okay, I'm like, Ben, you know what? You keep playing football, you're going to keep getting these things pretty much every time you go out, and that's going to be a problem later in life. Reason two would be, and this applies mainly to youth athletes, is every time you are injured, what is the degree of the injury? How does it affect you? Every brain is different in producing concussion effects. If I gave everybody here in the room, if we went outside and I bashed on the head with something the same way with some kind of machine, and then I measured the amount of injury that I induced with an fMRI machine we actually got here in the parking lot or whatever, right? I'm going to get 40 or so different levels of injury, but it's going to be a variance maybe like this. If I had a fancier machine that could go out and give you all different blows to the head so that when you went into the fMRI machine, you got the exact same level of injury, I'm going to get 40 different clinical syndromes, and they're going to be vastly different, right? So if you're playing a sport like football, hockey, something that has contact, some brains take very little injury to produce a significant clinical effect. Guess what happens to those people? They don't continue to play the sport, right? If you can't take a hit and not walk up, a simple hit, a regular hit of the game, and not walk away with a headache, you're not going to keep playing, right? So if somebody, every time they get concussed, produces an injury that lasts 4 weeks, 5 weeks, and is really, really bad, they can't go to school, you have to ask yourself, is the risk worth the benefit? You get a lot out of your sport. Sports are a really incredible part of our life and important in so many ways, but is it worth missing a term of school and falling behind in your grades and all of that? So that's reason number two, some people are just sensitive so that each injury produces a bigger concussion or a bigger clinical syndrome. Reason number three, which is I think the thing that most people are worried about, and Ben and I have talked about too, is there a sense of brain function changing over time because of hits you're taking? If there's no other explanation for decreased memory, sleep problems, mood problems, that kind of thing. That's a tough one because, like I said, the natural course of human events is that in your 30s and 40s you will start slipping a bit. And the more you work, the less you sleep, the more you drink, the less you eat well, the worse you're going to get. So it's a complex question, but those are the three things I would look at as far as when to suggest retirement. The last thing I'll say about that, though, is, and again, whether it's your career and you're making a lot of money, or whether it's what defines you as a high school sophomore, telling somebody to retire from sports is a big deal. And it's a huge deal, especially for those that kind of play the sport since they were 6 or 7. Well, guess what? Their brain developed while they were playing these sports, right? And if you take that from them, that causes problems. Absolutely causes depression. Absolutely causes sleep problems, grades to go down, even headaches in people, right? And so we must understand that equation is very, very complex and look at both sides equally.
So Ben, the thing that we hear about a lot, especially with football, is CTE, dementia, suicides, and just that kind of gets thrown around both in the media and among fans, all stemming from concussions from hits. What do you think about that as a player?
Well, I mean, to be completely honest and vulnerable with you, it's a scary thought. I was always somebody who had multiple passions in my life. So football was a part of who I was, but it wasn't who I was. And so it was one of the main reasons why I chose to walk away, is because there were other things, about who I was as a man, and a part of that now is my family. I have 3 beautiful daughters. I have 1 more on the way. So throw me some prayers and thoughts, because I don't know what I'm going to do with 4 girls. I don't have any idea. They're not going to play tackle football though, so I guess that, I'm safe from that. But yeah,
Rugby.
Well, I guess there's rugby, lacrosse, soccer, all sorts of stuff.
Or a reality show.
Oh, yeah, well, let's not go there for the reality show. But honestly, at 33 years old, I'm probably one of the youngest players who was involved with the NFL settlement. I was the only player to speak on on behalf of the players at the fairness hearing. And my biggest concern as I addressed this federal court judge was, you know, how can you guarantee that there's going to be someone to provide for my family if when I'm 50 years old I'm diagnosed with early onset dementia, like Jim McMahon? So it is a reality to me, and from the player's perspective, because we're not the medical expert, and we look at the statistics of the autopsied brains and how many of them have been diagnosed with CTE, and the effect that that diagnosis had on those players' lives before they had actually passed away. That's a reality for me. I don't know if it will happen. We can't say that it will happen. I pray that it doesn't happen. But it is a reality for me, and because it's a reality for me, I have to think about and live with the thought that, is there going to be a day when I wake up and I don't remember the names and faces of my family? And that's real for me. And I honestly think that was probably, once I started to experience some of those memory issues, is really why I chose to walk away, because the effect that will have really on my family is the greatest concern of mine. And I do think that's on the minds of players, especially players who do have a concussion history. And really trying to get them to care is a very difficult thing to do because of the money and the fame and the allure of playing at that level, and it is. And so, but I think it's something that we need to try and do.
You see patients all the time in your clinic that bring up these concerns, and I guess we'll just come out and ask it. Does playing sports equal brain damage?
How much time do we have left in our panel?
Um,
Well, so yeah, that's why we kind of called this panel that. So this is one of the most complex issues I think that we face in medicine right now. But it's also very perplexing because it's also one of the most visible, one of the most talked about, one of the most passionate, emotional issues that we have. And again, I keep wanting to just reiterate that, of course we care about our athletes who play sports on television, but this is applicable to anybody who's played sports, and it's more than just an NFL issue now, which is a good thing. But where I'll start with that to answer that question, I think let's put things in perspective first, and then we'll kind of talk about it, right? So the idea that getting hit over and over again in any kind of repetitive way is bad for your brain is not a new one. This was first described in the 1920s or so in professional boxers. At that point in time, of course, we didn't have some of the advanced pathology techniques we have now. We didn't have imaging techniques. So it was all basically a clinical definition. Former professional boxers were presenting with a very homogeneous, a very consistent pattern of behavioral, physical problems later in life, beginning in their 50s or so. And the first paper that described this was actually very, very clear about how consistent this was from person to person. It didn't vary very much. We called that the punch-drunk syndrome, or dementia pugilistica was what it became known as a little bit later. Muhammad Ali probably has some variant of that has to do with Parkinson's, but that's kind of what that was for decades and decades. The only thing that's changed is the idea that, well, not the only thing, but one of the things that's changed is the idea that it's not boxing alone, but it's some of our more popular sports. It doesn't take 50 professional fights worth of a career to do it. It takes only playing, in some cases, some people have said, just high school football, right? Now, what's happened in the last, I would say, 15 years is the conversation has changed from the clinical syndrome of what people are going through to what pathologists are seeing under the microscope on the brains of deceased people, right? In other words, when we started being able to describe changes that we are presuming are from contact, there's no, I wouldn't say there's proof, but there are suggestions to the point where it would make sense that, yeah, like I said, brains don't like getting hit over and over again. That's a pretty easy medical assumption to make. But basically getting CTE now doesn't have anything to do really in the larger perspective of how it's presented to the public with how you were doing clinically, but rather how your brain looked under a microscope. And just like I said before with concussion, people stop thinking. They assume that because your brain looks a certain way under a microscope, that's why you committed suicide. That's why you have these problems. Ben referred to the cases, the autopsies, series now, maybe 70 or so, maybe even more people who were exposed to contact sports or military environment, and then gave their brain to a brain bank and they found this problem. That is the lowest level of medical evidence there exists, a case series. It doesn't mean anything as far as incidence of disease, how often it occurs in a population. It doesn't really tell you anything about causality at all. It is a suggestion of a link, right? So in other words, when you see these changes under the microscope, and just for those of you who may have heard this term, tau is this protein that shows up in neurons in the brain of these individuals. It seems pretty clear, like I said, that exposure to forces, exposure to contact will give you some tau in your brain. But there are cases of people who have tau in their brain who don't have a clear neurological syndrome, right? Or it's very much a varied clinical syndrome. And so one of the metaphors that I think, or analogies, I guess, is that right, Joanne? Analogy, yes.
We'll talk about that
Okay,
later.
my English professor is going to correct me later, but analogy would be heart disease, right? I think everybody in this room, I don't see any people under 12, have some atherosclerosis in their arteries to some degree, some cholesterol buildup somewhere. How many of you have heart disease? Right? That becomes the level at which that problem becomes a functional problem, interferes with the function of that organ. If you get hit over and over again and develop some tau and never have a clinical syndrome, so what, right? I mean, that's kind of what I would say about that. The other possibility, and this is something that the pathology world is very much considering now, is that tau is a marker for exposure to contact, but not a marker for developing a clinical syndrome. So I think, and Ben and I have had these discussions, Ben and people like him are absolutely founded to have that fear is real. And I think there is a risk from being hit over and over again that you will damage your brain later in life. I think that risk is there. It's not what people define it to be with that very simple, you find tau, therefore CTE, you killed yourself, that's why you killed yourself conversation. That is way too simple. A couple of quick facts, and then we'll go on to the next thing. There was a famous, a really well-covered paper that was published about 3 years ago from the National Institute of Occupational Safety and Health, where they looked at the death certificates of former NFL players who had died between, the dates are late 60s to 2000 or so. And they found in that cohort of over 3,000 people, a threefold, roughly, risk of Alzheimer's disease, ALS, Parkinson's disease, right, versus the general population. That's a significant risk. The flip side of that is, though, still the majority of those people will not have a problem, and that gets lost in the conversation. You assume that everybody would, right? And the last thing I'll point out is it matters how we talk about this. I had a patient come into me almost 2 years ago who was sort of presumed to be the next, he was a former NFL player, three-time Pro Bowl linebacker, 4 years out was having behavioral problems, was having all sorts of issues, and was sort of labeled by people in his life as having CTE, and he was going to be the next person to have a violent ending and all of this. And he came to see me because his wife dragged him to see me to get some medical care. And it turns out that when you talked to this individual and actually took a history and thought about his case, he had an incredibly violent childhood, meaning he was violent. He had a violent personality disorder. He was kicked out of public schools until he was a foster kid. His dad was in jail. His dad was killed. His mom was in jail. And he was a ward of the state until at age 13, his uncle came by and said, you know what, you're going to go into a military school. I can pay for that. I can't raise you because you're crazy, but I'm going to put you in a military school. And he thrived. He totally thrived. He loved the rules. He loved the expectations. He loved that he could play football, which he learned it in 10th grade, basically, because he could beat somebody up legally. You know, he had that physical contact that he needed to treat himself. He then went on to a good Big Ten school, academic guy, for 4 years, and then in the pros for 9 years. So he had roughly, 14, 15 years of high-level human function, and then football came away, and then he started having problems. So did football cause his problem, or did football treat his problem, right? That's one example. Are there cases where absolutely the contact has led to problems? Yes. I'm not saying that's not the case. What I'm saying is we have to think. Because when we label people with that diagnosis and don't think about it, we've changed their life forever.
So, but outside of a diagnosis, let me just ask this just from a player's perspective, and it sounded like what I was hearing you say, really in between the lines there, to answer the question is, if you choose to play a sport where you're continuously hitting your head over and over again, the percentages do increase. You are at a higher increase than before when you didn't do that of potentially damaging your brain.
Yes, without question. The flip side of that, and just again, sort of clinical experience and from a neurologist perspective, the majority of former contact sport athletes, former military personnel who come to our clinics in their 50s and 60s with complaints do not end up having a neurological disease. Right? So the risk goes up, but we put it in perspective. And the best thing we can do for our patients, whether they are the 9-year-olds just starting out, the high school kids, the college kids, the pros, is follow them closely with good neurological evaluation. Right? I mean, I've got players now patients who are players who want to keep playing, and I end up recommending, here are the risks, and what I'd recommend is, come back every year and let's look at how you're doing. Let's do some advanced imaging. Let's do some neuropsychological testing. Let's really get to the bottom of, is your brain changing from one year to the next? Let's monitor you very, very closely. And I think if we had done that with Ben, we would have seen the things that he talked about, and would have, probably gotten to the same point, but made recommendations perhaps a little earlier that he not play anymore.
But the NFL doesn't use neurologists, so that's never going to happen.
No, they don't. Yeah,
that's another panel. That's another panel discussion.
But that gets to from my perspective, do you work for the player, do you work for your patient, or do you work for their boss? Yeah. Right. I work for my patient, and I don't care that the NFL what they use. Yeah. I care what you guys use, because that's that at the end of the day, that's what matters.
Yep.
So Ben, knowing everything you know, we're now in the third quarter talking about your future. What do you see as your future, and what gives you hope? What do you see is going on?
Well, that's a great question. Honestly, for me, it's become missional, because I as the spokesperson of the American Academy of Neurology, I get to help represent 30,000 neurologists across the country, and I get to listen to and learn and be educated on the truths behind this issue. But over and over again, whether you're talking to the Texas parent who is so diehard football, or it doesn't matter, we have an issue in our society with the nature of how we care about these things. And so really what my job is to share a story. It's to combine it with the medical expertise, but give an emotional connection so that we can begin to care about the issue. We can begin to care about, because everybody in this room, every one of us in this room, our lives all revolve around our memories. They all revolve around our minds. Each person in here has been given an incredible special gift in the organ of our brains, and we take it for granted. We don't even think about it. Okay, and so for me, really moving forward is to get you to think about it, and I'm doing that, through advocacy. I'm doing that with my music. I put out a music video called "You Will Always Be My Girls." It's the love letter to my wife and daughters from the perspective of the aging NFLer that may not remember their name someday. And it's got over 1.2 million views right now because it's hitting a nerve with people, and it should, because we all have it. It's all very important. And so I think moving forward, the hope is for me that through research and through the fact that this injury is being spotlighted, that we are going to find more of these answers. And if, let's say, CTE could ever be diagnosed in a living person, which I hope someday we can do that we'll have an answer for it. And we'll be able to really care for the long-term health of people who've suffered brain injury.
I think in the short term, your neurological health will be most challenged by having 4 daughters that are young at home. So we'll worry about that. So Dr. Kutcher, we'll leave it with you. What's the future of sports neurology, and specifically, where do you see, sports like hockey, football, soccer, things that we talk about a lot in the news? Where do you see them going from here?
Well, I also I have a sense of hope about where things are going as the conversation changes from one of just assumptions and that kind of thing to actually critically thinking about the issues. And I think as we increase research and get more folks who understand the complexities of brain function into the conversation, we will ultimately be at a better place providing the best possible care for our patients, which means to me allowing them to play sports when it's safe to do so, and not keeping people in a dark room in a bubble wrap. But I think all of our sports have changed and continue to change and should change to reflect our knowledge and understanding of science. I think there are a lot of things now. If you just took a sample of a survey of how our more popular sports are practice played, it's a lot different than it was 10 years ago, for sure. There's no question. And I think, unfortunately, Ben, you played sort of right up to the cusp where things started to change. For me, 2008 was sort of the time where things really, really started to change. And I think things are different now. And so I think whatever sport you're talking about, we'll continue to see refinements and rules, as well as, I hope, continued increased involvement of medical experts and resources. One of the things that I care deeply about is I don't think any sport should be practiced, any contact sport should be practiced without an athletic trainer on site. At least that. I mean, that seems like very simple, but half of our high schools in America don't have athletic trainers, and they're playing football. To me, that doesn't make any sense. Simple things like that. We continue to make the sport safer and safer. We continue to monitor people safely over time. I have hope that our sports will continue. We'll need to modify them, change the rules about when people can start hitting earlier in life. And in the end, I think we'll get this right. But I would, stress a little bit of patience.
Okay. And we're now in the fourth quarter. We'd love to take any questions you might have. Yeah, ma'am, go ahead. Yeah, you.
Testing, all right. Hi, I'm Corey Lathan, neuroscientist and entrepreneur. I wanted to just, one thing that I think that you bringing it out of the weeds of sports and concussion, I really like how you did that. I think it's been a great session. And my question for you is, I'll phrase it this way. We track, for example, body mass index, obsessively from the time kids are born. Every time they go into the doctor's office, we get, temperature, blood pressure, height, weight. How come we don't track brain health? I guess that's my question. I'll leave it at that.
Oh, that's a fantastic question. And I mean, that's a huge passion of mine too. I mean, I think, why don't we, or haven't we? I think it's because it's a very nebulous concept that people haven't been able to put a number on. There's not a thermometer for it. The technology there that we have to measure brain function, it's a moving target. And so I think we need to understand it better, and I totally agree. I think one of the things we do for contact sports too is every year they have to have a physical. Every athlete should, depending on what situation they're in, before they play.
Yeah, we talked about that.
A comprehensive neurological evaluation needs to be part of that every year. Not just a form to fill out, an examination. And if we have technologies that can help us look at brain function, whether it's electrophysiologically or MRI or something, we should employ those as best we can.
And I think that we can do that. What's one of the things I'm working on with the academy is how do we influence these things through policy, because there's all 50 states now have concussion legislation. And so we have to figure out how do we continue to increase that and keep the states accountable. And one of the things that we could mandate nationally is that is this idea that Jeff and I have talked about is, how do we mandate that in every annual physical that a young athlete has to take, they also do a neurological screening so they get on the grid, right? Much like my daughters will be with probably the same pediatrician all through their high school career. Could we do that for children across America, and how would that change how we can treat them? Yeah.
Sir?
Yes, my name is Tim Bella, and I'm the journalist who has been covering head traumas in college sports for the past couple of years now. My question is mostly focused on the public acknowledgement that this still happens, specifically in major college football. I know for the past couple of years, I've been tracking this, and I know less and less teams are publicly acknowledging that players actually suffered head trauma, and what I mean by that is a head coach or a head staff actually telling people in a public manner, hey, so-and-so got hurt in practice or in a game and so forth. Among the 4 playoff teams, the only one instance where that actually happened was found out after the suicide of Costa George. So I'm just kind of curious from your points of view, if there is ever going to be a time where that gap in knowledge between what the public knows and what the coaches and the training staffs know will ever be bridged.
There's definitely a player perspective to this, and
Well,
a,
so
and
here-
a
so
doctor
here's-
perspective.
Here's my answer. My answer, I don't think it's going to please you. I would hope it never gets bridged. As a physician, I don't know why it's anybody's business. What if fans of your paper or whatever you write for wanted to know about your medical condition? Like why is it anybody's right to know the medical information of the player? I hope that's your perspective. I mean, I get it. I don't know. It just drives me. And plus, the other thing is, the medical staffs exist. We do our thing. At least in my experience, our coaches, they just do their thing. And to expect them to know, to be able to explain medical stuff is just kind of ridiculous. And so, like, things you see here at a press conference from a coach or read in the media about injuries are never right. Well, not never. Sometimes. If they're right, though, it's not. I'm sure the journalists did a great job. I'm not saying they got it wrong. I'm saying the information they were given was not correct.
flawed.
And I would say, why does it need to be?
Well, I'm thinking about hockey, where they say someone has an upper body injury, and it really means that they probably have a jacked up knee or something. I mean, there's always an art of deception, but as Tim being a reporter, that we're looking to tell our readers and give context to what's going on. But I also, coming from a different perspective, why don't players have a right to privacy somewhat? I mean, there's HIPAA, there are laws, and especially in college, as you know, there's FERPA too. So I think we're trying to bridge the gap. And as you know, injury reports have become more and more, shall we say, vague and depending on the coach. And the problem is, though, the gap you're talking about is what we're being told, which sometimes, I'll be honest, are lies, and what we have to report, and then he knows when he reads that, or Ben reads it in the paper, that we got it wrong. But we're using the information
Some
you're
of the
given.
stories that I get, it's unbelievable. I mean,
Yeah.
It's incredible. Some of the things that have just been made up, I don't know. Exactly.
Thank you.
Thanks for the question.
Thank you.
Yes, this question's for Dr. Kutcher. Thanks for the wonderful information you've shared. I'm Len Zykowski, a psychologist and sports scientist, and follow the world of hockey more so than all the other sports, but this topic we are on is pretty dear to me. My question to you, Dr. Kutcher, is in March of 2015, do we have a kind of a gold standard, if you will, or best practice of diagnosing concussions? And also, at this time, do we have a good return to play protocol or a treatment plan to deal with concussion? 2015?
Thanks for the question. I actually would say that both of those things answer is yes. So the approach really is to perform a neurological evaluation, and we use terms like possible, probable, definite concussion on purpose because there's not a gold standard objective test. It's a clinical diagnosis. When you get all the information in front of you, this patient is presenting with a certain symptom complex. What are the chances it's concussion? Sometimes it's obvious, sometimes it's not. And so that's the approach you have to have. And it works pretty well as long as you give people the caveat that it doesn't have to happen in 5 minutes all the time, right? The return to play part of it is changing, and I think we have the next international consensus statement on concussion that I was fortunate enough to help write this last time around in 2012. We're having another one in a couple of years. I think one of the things you'll see is in a change in approach to return to participation that includes taking rest a little more cautiously and with a little bit more understanding of rest. Too much rest can be bad too, and using exposure to different cognitive and physical tasks as your diagnostic tool. We keep refining that, and that's, I think, where we're going.
So we've got a few minutes left, so I guess we'll take the people that are in line.
Hi. As you mentioned earlier, there is a lot of virality to this topic, and for athletes with significant concussion injury or histories, it's easy to get nervous about any little thing that comes along. Is there any advice? You mentioned earlier maybe ongoing neurological screenings or stuff. What can you do to be proactive? I guess is really.
It would start with really getting a comprehensive evaluation, and that would include, I would think, neuroimaging, neuropsychological testing, maybe EEG, depending on the situation, electro brainwave tests. But you really just need a thoughtful approach to the history and what the patient is experiencing. And then identifying all the factors that could be contributing to symptoms and dealing with them. And you'll be surprised at the things that we can improve on. And then, of course, I think follow-up doesn't have to be every year if you're not playing anymore, maybe every 2 or 3 or 4 or 5, depending on your situation. But, the things that the brains like, they love sleep in a regimented way, right? They love good physiology. They love to see exercise. They love good lifestyles, right? And so I think, to me, that's the thing I would do to be proactive, is just be as healthy as possible, and that means both physically and mentally.
You're our last question. Yeah,
So
you.
I am. I thought
You're
there was
lucky.
somebody behind me.
Yeah, no, you're good.
My name is Greg Wyszynski. I'm a hockey editor for Yahoo Sports, and I should first say that we know upper body injury is code for concussion.
Exactly.
It just is.
Or if it's Scotty Bowman, you say lower body injury, and then it means concussion.
Yeah,
so.
exactly. Yeah,
Yes.
it's gotten pretty blatant lately about
Yeah.
upper body meaning concussion. But I wanted to ask you about both hockey and football. They've both had these rules changes in the last several years, targeting late hits, targeting hits that target the head, trying to ratchet up the supplemental discipline that comes with those hits. Do you see that as meaningful change? Is it more lip service? Is it more covering their own asses because of lawsuits? Or how do you feel about those rules changes?
I think from the player perspective, I wish that the rules had changed when I played. I mean, just go Google my concussions and you'll see 2 are completely head-to-head collisions that were legal at the time, where my helmet was ripped off. I mean, he led with his head. And could that rule have saved me from a number of concussions? I mean, that reality exists. And, and so for me, those rule changes would have been beneficial. At the same time, there's a lot we need to do. It's 2015 and the NFL they don't have an educational program for their players. Last year, the players received a 1-sheet piece of paper that said, this is what a concussion is. If you have these 5 bullet-pointed symptoms, make sure you go tell a trainer. That's it. There's no educational program. And so really we need, again, the nature. This needs to be something that we care about, but those rule changes are important.
Oh, I would agree. I think in both football and hockey, I think the rule changes have been significant. And one thing I'll caution is not to use the number of diagnosed concussions that get reported, even in the official NFL, NHL numbers, as any sign of any kind of progress or lack thereof, because there are so many factors that go into that. I can tell you from the health perspective that I think both sports are healthier than they were 8 years ago. From the NHL perspective, I can tell you that unlike the NFL, they are taking education seriously. I actually been lucky enough to be with the NHL Players Association, where we go to every team when they're on the road in their hotel, like when they show up for the first time, and give them a presentation, just me and the players. And it's been really well received, and I think in general, a good step, something that we're trying to get the NFLPA to also do the same thing.
Thanks.
Thank you. Well,
Thank
we
you.
want to thank everybody for coming. We're available to talk with you out there. But again, thank you, and that's our contact information if you want to find any of us. And again, thank you, gentlemen, for joining us, and thank you.